if if you were listening to Dr. Cabrera,
Yeah.
14,000 Moderna vaccines arrived last night, and 21,060 Pfizer vaccines are expected to arrive hopefully today, and then 1,300 Johnson and Johnson vaccines should arrive. Those are the one and dones, probably by sometime next week.
All right, and let's go ahead and get here Mark Scott of the Guard, who they conduct the vaccination clinics, which are going to be starting back up next week, right, Mark? Good morning.
Hi, Hopper Day. Good morning, Chris and Bree, Jason, Joe, sir, people of Guam. That's right. We're going to start up on Monday. We got some expanded hours next week to look forward to, and an extra day, which is that Monday. So the event, right, links are up. Maybe you guys can help us post that. It's also in the news and on the Guam Guard pages, Facebook and IG. We're going to be running from 10 o'clock in the morning until 5:30 p.m. For people who need their dose 2, either Pfizer or Moderna dose 2. We understand that since we were out the past week or so, there's going to be a backlog.
Yeah.
So rest assured to the people that these Eventbrite links fill up, we're still going to accept walk-ins, but just at a limited rate per hour, so about 15 per hour. But feel free to come on in and get your dose 2 only next week.
Yeah, I think we've got our scan and plan graphic. It's up for people who want to just scan that link or that QR code, excuse me, and then it'll take you to where you need to go to start making your appointments.
Yeah, thanks for that, Bree. It's pretty user-friendly. I've gone through it myself just to test it out. It only takes maybe 3 or 4 minutes just to put in your name, an email address, so that when you register, it'll send you your ticket. Just bring that with you next week with some ID. Make sure that you're dose 2, and we'd like to get you vaccinated.
Mark, so what are we doing to kind of ensure we don't end up short and out of vaccines like we were for the last week with this latest batch?
All right, so as you just heard from the good doctor, we've got a shipment in of the Moderna and the Pfizer is expected today, which brings our total for the month of March all the way to 35,000, with more expected from Johnson & Johnson. So we look at the capacity of our clinics to vaccinate people and the amount that we've gotten for this month of March. We're going to have to do the math together with public health and make sure, that we meter out the dosage properly and we don't run short, especially for folks who might have already made an appointment. We want to avoid that this time for sure. But it looks like we're going to have more than enough this month. Hopefully we don't run into that.
There was something that was in the release regarding people who are 70 years and older. Are they going to be allowed to? Yeah, they're going to be moved to the front of the line, right? Armanumco.
That's correct.
Yeah.
So we have some services for accessibility too, for any folks, especially over 70 who need that assistance. We have the GRTA van, we got a golf cart, we have some wheelchairs, thank you, from Guam Memorial Hospital for that. And if you're a patient over 70 or you're with someone over 70, just kindly let us know. We're out there in the parking lot, we're out there at the checkpoint where you come in. Just say, hey, I got grandma, grandpa here, they're 70, or if you are, and they'll make sure that we relay that message and just come right into the front. We'll front load you.
Okay. Yeah, that's good to hear because we don't want to have any issues like at the beginning, right, when our Manumco were out there in the hot sun and things like that.
Yeah, you're right, Bree. And I'd like to say another thing, too, if I could, about having issues at the beginning. Since we understand there's maybe 6,000 to 7,000 people who missed out over this past week, we'd like to try to encourage people, if you want to avoid the longest wait times of the day, we're going to ask you to avoid lining up early. So even though we're opening at 10 o'clock, if there's a line going around UOG with 1,000 people at 8 or 9 o'clock, it's going to create some wait times for the people out there. So we understand, there's a lot of folks who are overdue and you want to be in there as soon as you can to get that dose too. But I got to say that it's probably not going to help to create a long line before the opening gate, just because we can only process so many per hour. and that will increase everyone's wait time. So feel free to come visit us if you're a walk-in. Come in the afternoon. It doesn't all have to be Monday morning, and we'll make it go as smooth as possible with your help.
Mark, when you have people registering with the Eventbrite, do you guys have any situation where you're sitting there with leftover vaccine at the end of the thing that you just got to use?
We don't have that problem, Chris, because of our walk-ins. They're always kind of there, always ready. We haven't, actually, we went over 100% for the month of February. You guys might have heard that. Of all the vaccines that we were given, we kind of surprised Operation Warp Speed by reporting a number of like 101 or over 100%. And that's because we're able to take every last drop out of those vials and put them into arms. At the UOG clinic, that means that our walk-ins that are there toward the end of the day, they're getting vaccinated and we're not throwing anything out.
Okay, you good? Anything?
Yeah. Was there anything else?
Is Dr. Shea bullying you?
No, I know Dr. Shea, and he's a good guy. Too bad he's a Packers fan. One day he'll be a Jets fan like the rest of us cool people. But no, he does what he thinks is best for the community, and we appreciate that.
Right on, Mark. Thank you.
Thanks, Mark.
Yeah, thanks, people.
All right.
Yep, thank you guys too. All right, and we'll see you next Monday, 10
All right.
o'clock.
Hooah! Let's go. Let's get it, man. Let's get these shots into these arms. The arms
Operation
are
Liberate
malaguer.
Guam, baby.
There you go. Okay, right on.
Right.
That's right on. Man, Dr. Cabrera's mom just commented, guys. Yay to